This is Kwame Bowen. He is a 69-year-old African-American male who has a history of high blood pressure. Lately, he has been suffering from severe chest pain. Living with chest pain makes it difficult for him to maintain an average, happy, healthy lifestyle with his family. He wishes there was something to help him combat his chest pain and high blood pressure. Thankfully, his doctor recommended metoprolol, which is a beta blocker. Metoprolol, also known as Betaloc, Lopressor, and Toprol XL. Kwame has learned that not only will metoprolol help with his high blood pressure, it will also help relieve his chest pain. Other uses for metoprolol include prevention of MI, decreased mortality in patients with recent MI, migraine, prophylaxis, tremors, aggressive behavior, and anxiety. Approved in 1978, the primary indication of metoprolol is hypertension. First dose combination formulations are available. Lopressor HCT combines metoprolol with a diuretic hydrochloride thiazide in a single tablet because it slows the rate and force of myocardial contraction. Metoprolol reduces oxygen demands on the heart and benefits patients with chronic stable angina. The action of metoprolol works by blocking the stimulation of beta-1 adrenergic receptors, not usually affecting beta-2 adrenergic receptor sites. This will cause a therapeutic effect of decreasing a patient's BP and heart rate, decreased frequency of attacks of angina pectoris, decreased rate of cardiovascular mortality, and hospitalization in patients with heart failure. This medication is specifically handy for Kwame because it can be taken orally as a tablet with a duration of effects lasting anywhere between 6 to 12 hours. A nurse's responsibility when having Kwame on this med is to monitor his BP, ECG, and pulse frequently when increasing or decreasing the dose, as well as monitoring his intake and output and daily weight. If a patient overdoses and presents signs of an overdose, use of plasma volume expanders or vasopressors will raise BP to normal levels and atropine to counteract the bradycardia. Isoproterenol may be administered for bronchospasms. Kwame's family needs to instruct him to take medication as directed at the same time each day. Kwame needs to be active in making sure he knows how to take his pulse and BP. He has been instructed to notify healthcare professionals if he has slowed pulse, difficulty breathing, respiratory depression, rash, fever, sore throat, unusual bleeding, or if bruising occurs.
Hopefully with Kwame's new administration of metoprolol, he sees a decrease in his blood pressure and reduction in his chest pain, letting him live a happy, healthy life. Some common side effects include fatigue, weakness, anxiety, depression, dizziness, drowsiness, insomnia, memory loss, mental status changes, nervousness, nightmares, blurred vision, stuffy nose, bronchospasm, wheezing, bradycardia, heart failure, pulmonary edema, hypertension, peripheral vasoconstriction, constipation, diarrhea, drug-induced hepatitis, dry mouth, flat chins, gastric pain, heartburn, increased liver enzymes, nausea, vomiting, ED, decreased libido, urinary frequency, rashes, hyperglycemia, arthralgia, back pain, joint pain, drug-induced lupus syndrome. Kwame has been taking metoprolol for 6 months. Let's hear his personal experience.
Before taking metoprolol, I struggled with maintaining my blood pressure, and after a while, I began to have severe chest pain. Thankfully, my doctor recommended metoprolol. Now my blood pressure has been maintained, and I have no chest pain at all. Before metoprolol, I felt like I was missing out on life with my wife and children. Now, after taking metoprolol, I have it back again, and I feel like I'm a new man. Thank you, metoprolol.
If you have experienced issues like Kwame, please consult your doctor about getting metoprolol today.